What if faster ICU recovery meant fewer sedatives, fewer days on a ventilator, and more time with a clear mind? Could a centuries-old therapy help you get there?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're examining how acupuncture may support recovery in intensive care, relieving pain, reducing drug burden, and helping you regain strength and clarity alongside standard treatment.
I'm Alara Sky. You're going to hear what recent reviews found about acupuncture in the ICU, how it may calm inflammation and improve circulation during sepsis or shock, and where gentler options like emotional freedom techniques, massage, music therapy, and mindfulness fit into a drug-sparing recovery plan.
Let's start with the problem. If you land in intensive care, you face risks that go beyond the illness itself. Heavy sedative and opioid use can prolong ventilation, cloud thinking, and slow the return to normal sleep and strength. Up to 80% of ventilated patients experience delirium, and nearly half develop muscle weakness that lingers for months. You need supportive tools that reduce those complications without adding more side effects.
A mini review in Frontiers in Neurology looked at randomized trials, meta-analyses, and mechanistic studies, and found that acupuncture, including electroacupuncture and transcutaneous electrical acupoint stimulation, may help you rely on fewer sedatives and analgesics, come off ventilators sooner, and leave the ICU earlier. Early data also show more delirium-free days and lower delirium rates, with benefits for gut function like easing constipation and reducing diarrhea, especially when tube feeding is involved.
Muscle loss after long ICU stays is another barrier. The same review reported that combining acupuncture with rehab improved strength scores and shortened ventilation duration by roughly 2 days. Some studies even noted increases in muscle thickness, a signal that you're rebuilding rather than just maintaining.
Importantly, the authors were clear. Acupuncture is an add-on, not a replacement for standard care. They called for large, multi-center randomized trials, standardized protocols, and long-term outcome tracking. The takeaway for you is practical. See it as a reproducible, low-risk adjunct when conventional therapies are limited by side effects or plateauing benefits.
A second analysis examined 12 clinical trials involving 682 critically ill patients and broadened the picture to shock and sepsis. Findings suggest acupuncture can modulate the autonomic nervous system, improving blood flow and reducing strain on the heart. In sepsis, it may dial down systemic inflammation and oxidative stress, support microcirculation that keeps organs alive, and nudge immune balance, boosting natural killer cells and T cells in lab settings.
Those trials showed symptom improvements and lower inflammatory markers when acupuncture accompanied standard care. Mortality didn't change in the small studies reviewed, but if your goal is steadier physiology, less inflammatory load, and smoother weaning from intensive supports, these signals matter while bigger trials catch up.
A 2024 narrative review stepped back and framed acupuncture as whole system support during critical illness. Instead of targeting one symptom, it organized potential benefits across 8 areas you care about: pain control, anxiety and stress relief, sleep quality, reduction of medication, side effects, respiratory support, circulatory stabilization during shock, digestion and nutritional tolerance, and functional recovery after critical illness.
Sleep and mental health deserve special attention. Poor sleep and anxiety aren't soft issues, they derail healing. Using acupuncture to reset circadian rhythms and calm hyperarousal may indirectly speed every other domain: pain, strength, cognition, because you recover faster when you sleep, breathe, and think more normally.
Outside the ICU, acupuncture shows promise across multiple conditions according to the World Health Organization, from headaches, neck and back pain, and sciatica, to nausea, hypertension, and certain digestive complaints. That breadth is one reason it's being evaluated as a system-level tool when several problems hit at once.
If you're considering a session, start safely. Talk to your primary care clinician first, especially if you're pregnant, on blood thinners, have cancer, or a bleeding disorder. Then look for a licensed acupuncturist. In the US, the LAC credential indicates standardized training and exams. Expect your first visit to run about an hour, with needling typically 30 to 40 minutes, and plan quiet rest during treatment.
Pay attention to what you feel afterward. Some of you will notice changes after one session: calmer sleep, less pain, easier digestion. Others need several visits before benefits consolidate. Feeling relaxed or sleepy right away is common. Increased alertness happens too. Your response is individual. Track it and share updates with your provider.
Needle-free options exist if punctures make you hesitate. Emotional freedom techniques use fingertip tapping on acupuncture points while you focus on a specific issue, and voice affirmations. It's a gentler route to calm the nervous system and can be guided by a practitioner or practiced on your own once you've learned the sequence.
Add other non-drug supports that complement acupuncture during and after an ICU stay. Mindfulness practices can lower pain intensity by changing how your brain interprets signals. Massage eases tension, reduces anxiety, improves sleep, and helps with the stiffness that follows bed rest. Music therapy, live or recorded and ideally personalized, reduces ICU-related anxiety, lowers blood pressure, and can make ventilation more tolerable.
When you're home, lifestyle choices help maintain the gains. Reducing seed oils high in linoleic acid and keeping intake below about 5 grams per day can support mitochondrial health and decrease oxidative stress. Choose stable fats like ghee or beef tallow. Bringing in omega-3s from clean sources such as krill oil or wild-caught fish like Alaskan salmon supports your heart, brain, and immune system after illness.
Sunlight rounds out the basics. Safe exposure, about 15 to 30 minutes daily, supports vitamin D, circadian rhythm, mood, and pain sensitivity. The guidance here is precise. Eliminate excess linoleic acid for 4 to 6 months before you seek peak midday sun exposure, then build up cautiously as you tolerate it.
If tracking seed oils feels overwhelming, you can use tools designed to estimate linoleic acid intake. Some coaching apps even include a seed oil sleuth feature to automate the process. Use anything that makes adherence easier while you rebuild resilience.
Here's your challenge. If you or someone you care for is recovering from intensive care, choose one add-on this week. Schedule a consultation with a licensed acupuncturist or learn a basic EFT sequence. And one lifestyle step. Replace seed oils with ghee or tallow. Add a serving of clean omega-3s or get a consistent 15 to 30 minutes of sensible sun. Note how you sleep, how your pain behaves, and how steady your energy feels over 7 days. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.